Hello, this is Don Meyer, and I am excited that you have chosen to join us for this short educational workshop on Medicare entitled Making Sense of Medicare. This is a presentation to help educate you on some of the complexities of Medicare put on by our company, Both Hands Financial Group. So let's talk about real quickly our goals for today. The first goal is to educate you on the different parts of Medicare, share common mistakes about Medicare, and then, of course, answer any questions. So if you have questions as we go throughout this, go ahead and type them into the chat box, and I will do my very best to answer them as we go along. Again, my name is Don Meyer. I'm the co-founder of Both Hands Financial Group. I've been in the insurance business since 1997, so I've been doing this for a while, and I've educated thousands of people, literally thousands of people on Medicare, and I have 7 children and 1 grandson. So I stay busy. So let's talk about Medicare and making sense of Medicare. Now there's 2 very important things that you need to know about Medicare. Number 1, it was never designed to take care of all of your health care needs or expenses. Never designed for that. And you need to choose an additional insurance plan to go with it. So let's talk about the different parts of Medicare called the ABCDs of Medicare. Part A is the hospital insurance. Part B is medical insurance. Part C is what's known as a Medicare Advantage plan. And Part D are the prescription drug plans. So let's take these one by one. First of all, Part A. That's your hospital insurance. Now with Part A, there is a deductible. The deductible for this year is $1,316 per benefit period. Now the deductible is what you pay before Medicare pays anything. Now, Medicare defines a benefit period as any stay in a hospital that is separated by 60 days. So if you go in January 15th, you come out January 20th, February 20th, March 20th, now it's March 21st, you have a new deductible period that starts. So if you have several hospital stays throughout the year, you could have several deductibles, which can really add up throughout the year out of your pocket if you don't have any other coverage besides Part A for your hospital bills. The second part of Medicare is Part B, which is known as medical insurance. Now, the standard premium for Medicare Part B is $134 per month for those new to Medicare in 2017. Now, your premium may be lower if you were on Medicare prior to 2017. Your premium also may be higher based on your earnings, which we'll talk more in depth about that in just a moment. Now, there is a deductible for Part B also. It's $183. This deductible, however, is per year and not per benefit period. There's also coinsurance that goes with Medicare Part B. You pay 20% of all of your doctor charges, and Medicare pays 80%. And 20% of doctor charges nowadays can add up very quickly. Let's talk about the additional premium that might be added to your standard Medicare premium. Medicare has decided that if you make too much money, they're going to charge you more. And they call this income-related monthly adjustment amount, affectionately known as IRMA. So you can see from the chart that based upon how you file your taxes, and it always works from 2 years ago. Because, for example, on January 1st of 2017, when your Part B premium is due, you haven't filed your 2016 taxes yet. So they go back 2 years and look at your modified adjusted gross income. And if you're, as a couple, as an example, made over $170,001, but below $214,000, instead of paying $134 for your premium, you're going to pay $187.50, and you can see how this chart goes up. I want to let you know something. You have the right to request that Social Security lower your premium. For example, if you made a lot of money in your household in 2015, and then you retired in 2016 and your income goes way down, then you can go to Social Security and say, hey, can you please lower my premium? Now, of course, I don't like to do this, but we can help you navigate this in the best way to help get you a good success for it. Because here's something to remember. These numbers are based solely upon income, not assets. So if you do it right and it's applicable to you, you could drastically reduce your Part B premium if need be. Now, it's very important that you get Part B when you are supposed to. For example, if you don't take Part B when you turn 65 or retire, you must have other creditable coverage, or you will face a 10% penalty per year for the rest of your life. Commonly, people think COBRA is creditable coverage. For certain parts of Medicare it is, for certain parts of Medicare it's not. So it's very important when you retire or you turn 65 that you get some good counsel on what truly is creditable coverage. Just because you have insurance doesn't mean it's creditable coverage. If you don't have it, for example, maybe you waited 3 years before you got Part B, you would pay 30% more than whatever the standard Part B premium is at that time, and you will pay 30% more for the rest of your life. So it's very important that you make sure that when you turn 65 or retire, you have somebody guide you and counsel you on the right type of insurance to get that is considered creditable if you're not going to join Medicare right away. So we've covered a lot of information here already on Part A and B. Let's do a quick recap, and that is Part A is the hospital, Part B is the medical, and together these are known as Original Medicare. That term is used often. So now you know that Original Medicare refers just to Part A and Part B. Remember, you are responsible for the deductibles and copays and co-insurance. Also, you need to know that the deductibles and premiums usually increase yearly. So you want to make sure that you understand that those costs are going to go up. And here's another key point to remember. There is no cap on your expenses with Original Medicare. No maximum out of pocket. If all you have is Part A and Part B, you could face some very serious out-of-pocket costs if you have some health insurance issues. Now, here's a question that came in that I do want to answer because it's a very commonly asked question, and that is about dental benefits. Most people are wondering what kind of dental benefits are offered with Medicare, and the answer is none. Medicare, Part A or B, neither one of those cover dental benefits. And since Original Medicare doesn't cover it, you also need to know that a Medicare supplement will not give you any extra benefits for dental. However, if you decide to join a Medicare Advantage plan, which is one of your options, some of those plans do offer some limited dental benefits. And you certainly just need to make sure that you talk with somebody who has access to all the different plans, and we can help you guide you through that if you're interested, so that you know if that makes sense for you to have one of those and if there will be dental benefits with it or not. All right, let's move on to the third part of Medicare, Medicare Part C, known as a Medicare Advantage plan. Now, Medicare.gov and your red, white, and blue Medicare book are going to define Part C as a type of Medicare health plan offered by a private company that contracts with Medicare to provide you with all your Part A and Part B benefits. So that is the official definition of what a Part C plan is. Now, these Medicare Advantage plans often have more benefits than Original Medicare. And some plans, depends upon where you live, charge no monthly premium. And I often have clients say to me, that sounds too good to be true. How can I really get insurance and not have to pay for it? Now, again, not everywhere across the country is it zero premium, but in many markets it is. But it's really not too good to be true. What's happening is this. Medicare pays these plans to take care of you. So it might be a zero premium to you, but Medicare is paying for your care, and they pay it directly to the insurance company. So that's how those plans work from a financial standpoint. Now, most plans include Medicare Parts A, B, and D. So one plan covers hospitals, doctors, and your prescription drugs. The other thing to note is that Medicare Advantage plans may offer extra coverage like vision, hearing, dental, or other health and wellness programs. And some plans even include a YMCA membership. It just depends upon the plan. Medicare Advantage plans, in addition to having co-insurance like original Medicare, often many of the benefits have co-pays, which is a set dollar amount. Co-insurance is a percentage. And one key point, Medicare Advantage plans all have a maximum out-of-pocket limit. What that means is that if you had a really bad year, heart attack, stroke, cancer, car accident, whatever, and you had a lot of medical bills, once you reach a certain amount that you've spent, the plan will pick up and pay everything after that for all your medical expenses. So just note that that is one of the parts that's built into the Medicare Advantage plans. Now, the next part is Part D, prescription drug plans. These are offered by companies contracted with Medicare, just like the Part C plans. And these each have a monthly premium. Now, again, if it's included as part of your Medicare Advantage plan, it may not. But if you're getting a standalone prescription drug plan, they will always have a premium. These plans have formularies, which of course is the list of covered drugs. And each plan has their own formulary, and none of them are the same. So you need to make sure your drugs are on the formulary of the plan you pick. In order to make sure that happens, you need to have a licensed, certified, and appointed agent run your medications for you and find out which plan is going to work best for you. Now, another important thing to know is that you should review your plan every year because the formularies change from year to year. Even if you did not change any of your medications, the plan might have changed their formulary, what tier it's on, or whether it's covered at all. And here's an example of one of my clients. I don't know if you can see this very well or not, but on the left, it's the comparison of the plan that I recommended to my client. The cost for their premiums and all their drug costs for the entire year, if they were on this plan here on the left, is $530 some, $538. However, if they would have stayed on the plan they were currently on for this next year, they would have spent over $3,500. So over $3,000 difference. And they were very glad that they reviewed their plan. Now, you can only change plans if you have an election period. And for most Medicare beneficiaries, that's during annual election period or annual enrollment period, which is October 15th to December 7th. So you may be able to change your plan throughout the year, but you must have a special circumstance in order for that to happen. Okay, let's talk more about prescription drug plans. You can get a standalone drug plan, like I just mentioned, with a premium, or one that is integrated into your Medicare Advantage plan. Now, just like Part B, when there's a penalty for you not having it, Part D is the same way. If you don't take Part D, when you retire or have some other kind of creditable coverage, you will also face a penalty. This penalty is 1% per month of the national average Part D premium for that year. And that penalty will be charged to you for the rest of your life. So if you're 3 years late, you're going to have a 36% penalty that you're going to have to pay forever. So that adds up. So you want to make sure that you have a drug plan or drug coverage that's creditable. I know this is a lot, but these Medicare rules are complex. In fact, I wish I had time, and it looks like there's a lot of questions coming in, which I don't really know if we're going to get to all of them, but go ahead and keep typing them in and we'll do our best. But there is a common mistake people make, which leaves them with drug coverage, but cancels their Medicare Advantage plan, which is terrible. So make sure to ask us if you have a question about that so you don't fall into that danger trap. Now, another thing that's important to note about Part D, there is also an IRMA, or an income-related monthly adjustment amount, that is added to your premium for those individuals who make a lot of money. It's the same chart and qualifications for Part B, so you're going to notice that this looks here on the left-hand side the same, but then you're going to pay an additional premium on top of whatever you're paying to the insurance company. Now, this money here does not go to the insurance company. This money for Part D, this IRMA, is paid to Medicare. So if you get a Medicare bill because maybe you're not taking Social Security yet, and you go, wow, this doesn't add up, you have to remember that you might be paying the IRMA for Part B and D, which is going to be added, and that is one of the reasons that your Part B premium and your Medicare bill is going to be higher. Now, another thing to talk about here quickly is the donut hole. This is technically known as the coverage gap, but often referred to as the donut hole. So here's how this works. Medicare allows 2 deductibles for any of the prescription drug plans. The first deductible is called the initial deductible, and currently the most that a drug plan can charge is, or allow for that deductible, is $400. And you have to pay the deductible, of course, before any insurance benefits kick in. Then what they do is they calculate when you and the insurance company have spent a certain dollar amount, $3,700, you have now hit the second deductible, which is where the donut hole begins. And of course, during that deductible, you also have to pay for your medications then. Now, there is a discount applied. You can see here that it varies. It's differently for generics than it is for brand names. But the long and short of it is they calculate the full cost of the drug to get you through that deductible, even though you don't have to pay the full cost of the drug. You only pay the discounted rate. And then once you've paid enough money, then of course you're on the other side of the donut hole, and then the plan is going to pay or the Part D plan is going to pay 95%, and Medicare is going to pay, and you only have to pay 5%. So the wording on this is a little different, but you just need to know that if you are uncertain whether or not you're going to hit that donut hole, make sure to ask one of us, because we can put you into our software program and we can calculate whether you're going to hit the donut hole or not, which is an important thing to know from a budgeting standpoint. And again, that is something we can easily help you with if you have questions on it. I love this little slide here. I'd retire too if I could only figure out that Medicare drug benefit program. It is not intuitive. There's a lot of things that make people scratch their head on it, so it is important to make sure that you're choosing the right plan. When it comes time to review your plan every year, one important thing to note is this. There are no health questions with these plans. These insurance plans ask no health questions. So from year to year, you can change, even if your health has changed. It's why we strongly recommend that everybody reviews their prescription drug plan every year, because you don't want to be spending $3,000 or $4,000 or $5,000 more than you need to. Okay, let's talk about Medicare supplements. Some people call them Medigap plans. These are not from the government. These are plans from insurance companies. Now, these plans generally pay the 20% gap that original Medicare, the Part B, doesn't pay. And these plans have letters attached to them, like Plan F, for example. That's the most popular one, so you may have heard of it. And each plan letter must offer the same benefits nationwide. So Plan F with one company has to have the same benefits as Plan F from every other company. And Plan N and Plan G, they all the same way. Every Plan N has the exact same benefits. So there is a monthly premium, and it generally increases each and every year. There is no drug coverage that can be part of a Medicare supplement plan, which means that you would have to get a separate plan for your drug coverage. Now, one more important point. You can never be dropped due to bad health, or maybe you have a lot of claims. These plans are known as guaranteed renewable. So that is an important thing. Also, you can never be singled out for a rate increase due to claims. That is not allowed. So they can't say, well, you've had a lot of rate or a lot of claims, so we're going to charge you more. Nope, can't happen. And some of these plans are actually going to be discontinued in the year 2020. So people who want to enroll into one of them will not be able to. So if you have questions on that, we can answer those questions. But just note that in the future, this is going to be changing again. Now, Also, want to let all of you know that there is help out there for individuals with limited income and limited resources. There are programs that can help you. If a beneficiary has limited income and resources, they may qualify for what's known as a low income subsidy, or LIS. And what that means is you would receive extra help from Medicare to cover all or part of the Part D premium and cost sharing. To qualify for extra help, you must have lower income. In fact, the beneficiary income may not exceed 150% of the federal poverty level. Now, the federal poverty levels do vary geographically, but for most states, it is $17,655 for your income for an individual and $23,895 for a couple. Now, you'll also need to remember that not only does your income make a bearing on whether or not you can qualify for extra help, but your resources or assets also do. Not all your assets. They don't count your car. They don't count your home. They have, but again, we can walk you through this. If you're wondering, boy, I'm having trouble paying all my bills, I'm having trouble paying for my medications, could I qualify? You might. If you think you could qualify for extra help, but you're not receiving it, we can help you apply. It's important to note that the government does not automatically give you extra help. You have to apply for the extra help. And as you can see from this list, there are more than one level of extra help. And so if you need some guidance and helping walk you through what would I qualify for, which level of benefits might, apply to me, we can help you with that. So basically right now, you have two choices. If this information was helpful for you and you want to go out alone and do all the work to learn the medical insurance and federal benefit legalese, research companies, plans, and benefits, you could do that, and you could pick your own plan. Your other option, of course, is to work together with a licensed, certified, and appointed agent. And I strongly recommend you work with one who's able to offer many different plans. I have clients where the husband is on one kind of plan with one company and the wife is on a different plan with a different company because their situations are different. Their health is different. So there's no additional cost for us to help guide you through the process. You'll pay the same amount to the insurance company whether you go direct to them or whether you come through us. And so we are happy to help you with making these important decisions. So let me I know we're running out of time here, but I see there's a lot of questions coming in, but there is one question that I saw here that is very commonly asked, and I want to answer that one. And that is, which plan should I get? In other words, should I get a Medicare Advantage plan or a Medicare Supplement plan? And that's a great question. And you know what the answer is it depends. It depends upon a lot of factors. When I counsel with folks with, trying to pick the right plan for them, we have to take into account their health. We have to take into account their finances. We have to take into account, kind of their insurance philosophy. We have to take into account the list of doctors and medications and all this kind of stuff. So for some people, having a Medicare supplement plan is the greatest thing. For other people, it may be that you need a Medicare Advantage plan, or that may work better for you. So again, give us a call. Let us know if you'd like to talk with us. We can help guide you through that process. We are out of time right now. We will get back with all the rest of you who have typed questions in. But thank you so much for attending our educational workshop on Medicare today.